Thank you all for being here today. I'm dispensing with the usual long-winded introductions to say that I'm thrilled and honored to be here in what's now my 5th year as your CEO, and in my 32nd, or almost, I guess, start of my 33rd year here at Children's National. So it's really, you know, a time in a sense of reflection for me, and that's what I wanted to do this morning, is kind of look back, but also look forward and think about some of the great things that we've accomplished and the things that we have in front of us. As I was getting ready this morning in my office, I was just thinking about the talk, and I saw my white coat, you know, on the hanger. And it had been on that hanger for too long a time, I think. So I felt like, you know, today was a good day to get that white coat back on. And, you know, at the heart of what I am and what I think I bring to being a CEO is being a physician and being part of a team and working with doctors and nurses, taking care of patients and families and children. And I think that's what's at the heart and soul of Children's National. And that's what we're going to talk about today, our journey to excellence. Now, many of you remember last year we had a grand rounds, and it was, in a sense, a wake-up call. I got a love letter from Amanda Leland. Amanda's here today, here in the front row, or not the front row, but over there with her husband, Eric. And she had sent me a letter about, if you recall, and we handed an excerpt of the letter out for those of you that weren't here last year or may not have seen this, about just the great care that is provided here at Children's National. But there were some things we could do better. And in any loving relationship, you can always, there's a trust and an honesty and a transparency that builds up, and part of that is that you can share some of the things that work and don't work. And I think that's how Amanda and Eric and Tegan felt. And so we spent some time together, and Amanda spoke with me, and we challenged ourselves to what we could do about some of the issues. And we kind of framed it in around a book that many of you may have read or thought about, called Good to Great, about organizations that go from one level to the next, and what it would take for us where we thought we were good, but what it would take to be really great. And I asked each of you at that time to refocus, really refocus on putting kids and families at the center of all we do. Because it is easy as a physician, as a doctor, to set up things for ourselves. And I think that was one of the situations that the Lelands found themselves in last year, or last year. One of the cases they talked about for their daughter was that everything was doctor-centric. So it was one doctor or one service's approach to a certain protocol for getting an MRI and anesthesia. But there was another doctor and another service that had their own protocol, and they hadn't really talked to one another, and they sort of got into a little bit of a clash around that. Meanwhile, Tegan, who's been NPO for, 12 hours and has been getting all sorts of fluids to get her ready for this MRI, the MRI gets canceled. And everybody was trying to do the right thing that they thought was the right, but they weren't kind of coordinated and talking to each other. That was sort of the basic facts of the situation. And so I think we, I and all of us, I mean, I remember all of you just getting so fired up and enthusiastic about the idea of, hey, let's look at these issues together. Where can we we know where the problems are, and how, if we just put our egos aside and put a lot of things aside and began talking and working on things, could we make a difference in that? That was the challenge. And I am proud to say I believe we have. I didn't have to look far for pictures of doctors, nurses that are having fun and engaged and thrilled with their work. And does everybody know who this is? Is he here? Well, this is our chief of pulmonary, and he is just loving this baby, and you can just see how that all that works, and that's what our kids and families expect from our doctors. And Tassos, I hope you're on the WebEx, but you know, it's just wonderful to see how people responded to this challenge to be good to great, to wanting to work with others. And that's what I love about Children's National, is that we can come together. So I thought I'd give you some examples that have been sent to me. This is not a comprehensive list, because I know there's just, I could find 40 or 50, but these are some of the things that you have sent to me about how we have moved forward. Some of the examples, some of the people, some of the teams. We're lucky to have the Hayes family with us in the back row there. And this is just one family among many, but they wrote to me, and this was around their son, actually Ryan. They were living in New York and were originally from Washington, D.C. And they had 3 children, but one family, and the key to the start of all this was Ryan, who needed heart. There he is. Here, and I have a seat. For you. I know why the service is definitely getting better. Yes. I know why Tassos was a little behind, because he was taking care of a very sick patient and talking to a family. But we're now talking about Ryan, who needed heart surgery, and the family, although was from Washington but was living in New York, and wanted to come to have heart surgery here at Children's, and actually wanted to move to Washington. But you know, coming to Washington and then coming to Children's from afar, and you don't really kind of know where to go, and you've got one child that needs something, and meanwhile, then you have 2 other preemies, twins, that also had their own, and you can just see the challenges of a family that, and this is not unique, this is not rare. I would say more and more of our families have situations just like this. They need multiple appointments. And so just put that in the framework of what I said before, how things were set up for doctors and our appointments and our waiting times and our call center and our waiting rooms. Those are all set up to serve the doctors. But think about whether that really serves the patients. So you got a family that wants to move here from New York. They know they have all these needs. They know they know they need this network. And how are they going to create that on their own? They don't know much about medicine or the system. There's insurance issues. Who knows what? What I'm thrilled to say, and we've created a Nurse Navigator program, and some of you have experienced that. And it works so well that we, well, is Eileen here? I thought I might see her. Eileen, would you just stand up for a second? I know you don't like to stand up, but please stand up. Eileen Walters was our first Nurse Navigator. And she worked with the family, sight unseen, and began putting together the care network. And she worked with many of you, and the other unsung heroes are the people at the front desks, the registration clerks, the nurse practitioners, all of the groups that support having a complex scenario like this. And I'm happy to say that Ryan's heart surgery went well, and that Vivian and Audrey are moving along and moving into the system, and things are going well, and I think that's partly why they wanted to be here today, to support and celebrate you all as a team for working to bring their family along and get them situated in a good way. Now, our success with the Nurse Navigator program and this care coordination, and is Susan here? Susan, well, here's our next Nurse Navigator, Susan, if you just want. So we worked so well, we, hired, how many more have we hired, Linda? 4? We have a total of 4 that work in different areas. Now, some of this is a bit of a workaround because it'd be great just to, have everything work seamlessly, but sometimes it needs people in that loving touch and then experts that know how the system works and what the patients and families need. So one of the things when I created the Nurse Navigator program and then Eileen was our first one, was I asked her to focus on where are some areas where we're having problems and patient populations and families where we're having problems. Oh, I'm sorry. We have a quotation here, and that, I think that's Ryan there. Is that Ryan in the is he texting or have a driver license? I can't really tell. And that's one of the twins. I'm not sure which one, but it was the little things Eileen helped us with: where to go, how to park, feeding time, she'd get hot water for bottles or find me a place to pump. She made sure everyone got the right medical records. She booked appointments. I couldn't have done it all without her. So, that's a real testimonial. And that's the kind of mindset we all should have. There's multiple examples of that, how you all go forward. We celebrate those with the Power of One awards, where people are just doing all sorts of amazing things. And some of this is done every day. So I asked Eileen to focus on populations, and one of the populations that jumped out at us was we were seeing more and more kids at Children's National with autism, and not necessarily for their autism, but they had autism, but they were coming in for lots of other reasons. And as I just have some headlines here just to show that as many of us have experienced, the incidence of autism seems to be rising, and there's a lot of focus on it, and we have made a big investment in the research and lots of things around autism. But meanwhile, Eileen and Dr. Atmore came up with an idea of making our hospital an autism-friendly hospital, because we were finding out some things about how we were caring for children with autism. Most people that didn't deal with these kids every day didn't really know much about how to care for autism. So there was one family in particular we wanted to highlight, and we asked the mother, what would you want your care providers to know about patients with autism? And so she said, and he's a nonverbal child, she said, he can't tell us when his head hurts or what he's feeling. So as parents, they look for the little signs. And it's huge when doctors take our observations seriously, when they don't look at us like we're crazy, and when they work with us to figure out what's going on. So many of the parents said that a lot of our doctors and nurses really would, if they said, well, we know he's upset when his eye twitches, they may not pay any attention to that. But that family's with that child all the time, and they know that that tiny little eye twitch is the signal that that child is having anxiety on the inside. She also said that people often talk about what's going on in front of him as if he isn't there, but he can sense he's not being included. So because he's autistic and nonverbal, he's over there and the doctor is talking to the parent, but as if the child's not in the room. But he's, you know, there's a lot going on in his head, and he recognizes or picks up on the cues that he's not important. That's an easy trap to fall into. And then some people are afraid to examine Ian because they're scared it'll hurt them, because he can get, when he gets agitated, and but they could ask him questions like, Ian, how do you like to be touched? And that kind of lowers the anxiety level. And he, you know, whether you can understand what he's saying or not, but that may just, there are ways to calm him down. And so Eileen and Dr. Atmore really went to work, and many of you have been involved with this around the education of our staff about how to care for these children, how to deal with these families. And we have a program now called ABC, and I can't exactly remember what the ABCs are, but that program focuses on creating a plan for each child, and so that people know what's going to happen. So Ian came in for blood drawing, which frequently in the past had been a very intense affair. Sometimes security would have to be called. It was people were scared, but through this program and working with Amy, they found out ways of working with them so that he could have a very easy and safe blood draw. So it meant having a quiet space, that they didn't have to wait a long time while he was getting agitated in one of the waiting rooms, that there were positive distractions that he could work on. And I think his favorite movie is the 1997 original version of Winnie the Pooh. It's one of my favorites. But the child life and critical participants here would bring a preloaded iPad, think about that, to the blood draw so that the child, you know, that was what he really liked. And they'd wrap him in blankets from home, and then the child life specialist would work with Ian while the blood was drawn. And so this ABC program is something we're going to be really expanding. It was made possible through some great philanthropy from the Ewings. And what does, remind me, ABC? Autism Behavioral Communication. So we're well on the way, and that's just one of the examples of how we're working on population and trying to improve things. And I am getting more and more letters of kudos, and the way this works is then the families, and there's these social networks out there of families, in this case with autism, it starts spreading. Hey, Children's is a place you want to go and be because they have people that really understand the needs of our kids and families. I was proud of this one because if you remember back to the situation that the Lelands faced, and some of it was around the anesthesia coordination, and we had a new chief of anesthesia, Jeannie Heitmiller, who's on the front row, one of our leaders, and I want to say that she's been here one year, and she's already sitting on the front row. So she took this, and her whole anesthesia team took this to heart, this good to great notion. So this was this is just a single case, one patient in a single day for a 1-month-old baby girl that was having different procedures. And if you look at that, you see that there's a bronchoscopy, there's an MRI, there's a cardiac cath, all sorts of different services nursing teams involved, radiology, technologists, neurosurgery, transports, and, you know, last year that would have been, I don't know how much, you know, whether we would have pulled this off or not. But I think through the efforts of planning and coordination, and I know that it goes way beyond our anesthesia team. I know Dr. Z in radiology, his team really stepped up. The cardiologists stepped up, and have all come together with these protocols and planning so that more than a dozen people from different units planned this. 50 emails were exchanged, but there was one single point of contact for the family. So they didn't know that all this was happening in the background. And they weren't the ones that had to make all the arrangements, which frequently is the case. They just turned it over to cardiovascular anesthesia, who began doing all the coordination, and it was a very, very successful outcome. And, you know, that's the kind of approach we need to be taking. So kudos there. And I know this is just one case, and it probably happens, you know, every day. There's another set of work that was brought to my attention, and this is on the nursing units. And this has to do with the IPASS P, and there's lots of different handoff works because that's become identified as an area of weakness in terms of safety. Frequently, you all know this, but things get dropped or lost, or important information isn't passed on from one shift to the next shift. And that's happening in nursing, it's happening with doctors, it's happening all through medicine. Oh, there's Dr. Atmore, I missed her. Can you stand up? ABCs, there she is. So IPASS is around nursing. It's just great work. And some of the principles here, and I may get this wrong, but there'll be people that'll jump up and tell me if I do, is when the nurse starts following this protocol, there can be no interruptions. So you gotta focus. Is that right, Linda? Gotta focus all the way to the end. Listen, listen, listen. And then at the end, I think it's important, the person, the receiver, has to summarize. Is that blurry? Yeah. Why didn't somebody say something? So somebody at the end says, summarizes what was heard. And so that there's a clear, I know Grand Rounds next week is on eye screening by Dr. Jafar. Maybe these were his slides. But anyway, the has to make sure that they understand what was going on. And how many times, what's the percentage now that we're doing that? Is it, but I know we're supposed to, but are we doing it 100% of the time? I'm not going to ask the leadership. Nurses on the floors, are we doing this 80% of the time? We're getting there. We're getting there. Who said that? I love that answer. How long have you been at Children's National? Debbie Freiberg. Does everybody know Debbie Freiberg? But we're getting there. So she's been here at least 35 years, and we're still getting there. But I want this to be 100. I want this to be 100%. Because it really feels like an important thing for how we do things. I thought this was a good one. This was a pilot, and I think it was a combination between our strategy team and our doctors and our residents and the hospitalist service, right, Karen? And so these are baseball cards, and what is great about them is that you see it identifies who the person is, what their role is, and then what the definition of the role is. So a lot of people don't know what an attending is or what a resident is or what it means. So that's very cool. And then on the other side, it gives some information about Dr. Halley, and that She worked here since 2006, has a couple of boys, has been a parent, and so on and so forth. Is Dr. Hallie here? I didn't get clearance to use her card, so it's our Chief Legal Officer here. Where's Mary Ann? And those of you that don't know, our Chief Legal Officer is a nurse, and she and I started about the same time. She was a nurse on, does anybody remember 4 Orange? Where are there some graduates at 4 Orange? Dr. Silver, you worked on 4 Orange, I remember that. But look what happened. So we surveyed patients, and these are the, before the cards is blue, and then after the cards is green, and look at this was about how people felt about the different issues. Was the care coordinated? Did the doctors identify their roles? And just overall satisfaction. We moved to a whole new approach on terms of our focus on the children and families. No longer would the trays come up at a certain time that worked for the cafeteria department and how we work things, but we flipped it around, and Kathy Gorman and her whole group flipped that around so that it was when the patients and families felt like they wanted to eat, and that there were different possibilities for the children to eat based on their medical capabilities. And just look at the scores on that, so that this was around the quality of the food. And, you know, it just kind of bounced around for a long time, but now it's clearly on a trajectory up with the launch of dining on call, so they can put in an order, and the order comes up. So that's how we're starting to think about patients and families and putting them at the heart of what we do. I'm really proud of this one in terms of the doctors and physicians. It's not easy to be transparent and put your data out there online, and whether it's good or bad, it can't be edited. It's just out there, and this is around our doctors deciding, and Dr. Cora Bramble, Dr. Wessel led this. They're somewhere, Dr. Cora Bramble, where the reviews by the parents are posted online for anybody to see on our website. You have to have 30 of those. And I think what was fantastic was that we were the first freestanding children's hospital to do that. And I think another interesting thing was, because there was feedback, and we were listening to what was in the feedback, the doctors improved. So their star ratings went up from 4.4 to 4.6. And it's been, I think, successful enough that now we're expanding it from where it was a pilot to more and more doctors. And I believe this is good, because this is going to happen anyway, but it's just going to be some other website or service that'll be doing it on us. Here we are. It's ourselves asking our own patients and families, you know, what worked, how can we get better, and we're showing that kind of improvement. There's a lot of evidence now that the patient satisfaction is improving. So we measure this. We use different tools. One of those is Press Ganey. So I'm really proud of the work you all are doing. This just looks at between the light blue is fiscal year 10, and the red is fiscal year 16. So if you look at the inpatient, this is the percentage of patients that said that they were likely to recommend Children's National, and that the overall, which is a key question, and so the overall, it's really a significant improvement. Those point things is another measure, but it really is. What you want to know is that people will recommend your hospital, your doctor, whatever, to other people. And we're gaining recognition. So I know you've heard me talk a lot about this before, but we're one of the top children's hospitals in U.S. News and World Report. All 10 of our specialties were ranked in the top 20. There's only 4 children's hospitals that can say that: Boston, CHOP, Cincinnati, and Children's National. So that's not a bad group to be in. Our neonatal intensive care unit was ranked 3rd in the country. Where are all the neonatal folks? You're all here somewhere, but kudos to you for that. We were also ranked one of the 100 great hospitals. That's adult and children, pediatric hospitals. There were, I think, 10 or 12 children's hospitals in that group of 100. We were the only one in Washington, D.C. in this region. I think Johns Hopkins in Baltimore was there. Leapfrog, we were one of the safest children's hospitals. There are 12 children's hospitals that got that recognition. And then, you know, probably the thing we're most proud of is our magnet redesignation. And that went through without a hitch, a tremendous amount of work. What percent of hospitals are? 6% nationwide. In this region, the only magnet hospitals, it's the highest thing you can get in nursing, are Georgetown and Johns Hopkins. ANOVA used to have it, didn't go back for it. So I really want to thank all of our nurses. Where are they? Because this is huge. Can you all raise your hand or do something? And I did want to, I meant to say this on the inpatient. There's a lot of work to do, and I heard about different ways that we're improving that. Dr. Smith, Karen Smith, Chief of the Hospital Service, also a nurse. But Karen and her team found that there was some dissatisfaction by the patients and families on the weekends, because we weren't doing some of the things on the weekends that we do during the week. And one of those was having patient-centered rounds. And so she and their team, they had to do a lot of work with the residents and so forth, but they started doing the patient and family-centered rounds on the weekends, and that's had a huge, huge plus. So all of those things where we're starting to think, okay, it's not okay to not do the same thing on the weekend that we do during the week, or the same thing we do at night that we do during the day, because that may create safety problems or patient dissatisfaction problems. That's the way we got to think. And that hospital service is at the forefront of thinking that way. Now, there's more work to do. So this is just one of the issues, and I know Dr. Cora Bramble and others are going to be talking with the division chiefs about this, but this is around our patient access. We've made huge, huge improvements. We have some services, I think 5 or 6 services now, where you can call and you get a nurse practitioner or a doctor that day, and they work with you to decide when your next appointment is. It could be that next day, or it could be in a week, but it's really, in a sense, same day or next day service. But we have lots of other services, and believe me, when people think of Children's National, they think not just of the service that they're calling, but they think about the whole thing. So this is some recent data that Denise provided to me, and the red lines are the number of calls that for a division. You know, I've taken out the names of the division. The next time I show this, I'm going to have the division names up there. I guarantee you that. But, you know, I want to give you guys a chance. So, look, I've been in your shoes, so I know the deal. But think about the red is the number of calls, and the blue is the actual number of appointments. So there's a ratio, right? So the ratio would be to divide the number of visits into the number of calls. So if you're a parent, what do you think is going to happen if it takes you 3 calls to make 1 appointment? How long are you going to put up with that? Or what if you have to call and make 2 appointments? And you start multiplying that complexity. Or you get on the line and they say, well, you know, we have our next available is in 6 weeks. So you'll probably take that appointment, right? Because you want that appointment for your child that's having a, a bad, an issue. But what else are you going to do? Yes, you're probably going to call Georgetown or Johns Hopkins or Inova or somewhere else, or even an adult provider, to get an earlier appointment. So people talk about our no-show rate like there's a big surprise, but, this is at the heart of it. We need to be thinking, too, and this is a little bit of a pivot, but so I've been, I'm appealing to your hearts and your hearts around thinking about that mother who might think that their child's headache is a brain tumor, or they have abdominal pain, and is this, something going on serious or whatever. But also now I'm going to think about it as a customer. Any business that showed this would be destined to be a failure within a year or two if they're treating their customers as if they're not important. If you think about any other commodity or product, if you had that much effort and difficulty to get what you needed, and the worrisome thing for us is that there are more and more tools for families to access other approaches. So I can go on right now and probably get an appointment tomorrow for my child at the Cleveland Clinic. Or I could go online right now and get a virtual visit with somebody at you name it. That's what's happening. So if we don't solve this and solve it fast, we're going to end up being like Blockbuster to Netflix. Seriously, that is what is going on. So this is a call to action. Dr. Cora Bramble is going to be discussing this with the division chiefs, and I'd love for you all to make some progress there. We are moving forward, as I said, on the this is around our data on the different units and how we look at things, and we have really made a lot of progress, but there's work to do in terms of our patient satisfaction. I know nurse rounding has made a big difference, but what is the neonatal intensive care unit doing that the emergency department isn't doing? Let's figure that out. Or the inpatient services or the specialty clinics. We need to solve for this because these are the things that our parents and our consumers, our customers, they're going to have the capability of making different choices if we don't adjust. Plus, it's the right thing to do. So, what about getting to the next level in terms of our ability to innovate and our reputation? And I'm really proud of what's going on here. I think many of you know the story of our involvement and leadership in terms of the Zika virus and its effect on fetuses. We built a great fetal program, never knowing that there'd be a virus that would come along that would be transmitted from a mother to a fetus and affect the developing brain. We built the fetal program around the brain, and Dr. Limperopoulos, Dr. Duplessis, their whole team, and that a lot of it is around the brain development, but we didn't know that the Zika virus was going to play right into that. And, chance favors the prepared mind, and we were able to participate and take care of one family that got written up in the New England Journal, and our team was part of that, along with Johns Hopkins. And then a team went down to Brazil, and we are off and running. But I think the other important thing is we have a multidisciplinary clinic that Dr. DiBiase and others have created here for mothers that are worried and want to be evaluated. And these are some of the MRI scans that show the different effects. Just today, and the embargo came off of this last night, so I can show you this. Does anybody read Popular Science? Marshall Summer? How come our bioengineer? Yeah, there you go. So this is a robot that's been developed in our Sheikh Zayed Institute. It's called the STAR robot, Dr. Peter Kim. I thought I saw Peter here. There he is, Peter. This is his work and his team, a big team, and this robot is used it's hooked up with artificial intelligence to actually do surgery. And so it was chosen as one of the greatest technology advances of 2016. So Children's National. And in full transparency, being a surgeon, I'll read the last sentence. STAR spaced its sutures more evenly than both human and human-assisted robotic surgeons, a sign of a procedure well done. So kudos, Peter. This is another example. These are the companies that are being spun out of Children's National over the last 2 or 3 years. And a lot of people, this is a move through our Sheikh Zayed Institute, our Children's Research Institute, and our clinical services to take their great ideas and think about commercializing them and spreading them to other children's hospitals, other scientists, and most of all to patients. Now this is a little bit of education, because a lot of you have talked to me about you don't think we get enough recognition. At Children's National, we need to get more recognition. We need to do more advertising. We need to do different advertising. Is Lauren Fisher here? There's Lauren Fisher, who's head of our PR and marketing. So I asked her about that, and she went and did some research, her team. And this research, we, I think, asked these were people in our community, what is it that, to you, differentiates the best children's hospitals? Not why would you pick a hospital to take your child to, but more, what differentiates you? Why are some of those hospitals, other children's hospitals in the, 1, 2, 3, 4, where we rank around 10, what is it about that? And they said, no surprise really to us, but it's around your leading physicians, cutting-edge tech, research, national recognition, and validation. It's your recognized expertise in what you do. It's your doctors and scientists. A lot of the other things, conveniently located, quick to schedule, take my insurance, all of those things are assumed, but they don't differentiate you. They just assume you're going to do that. And if we spend a lot of time being proud of that we specialize in pediatrics and we're advocates for children's health, but that doesn't differentiate you, and that's just the reality in being a top children's hospital. So we, using that research, and we went back and asked another question. Where does Children's National fit in those different categories? And I was really surprised. We didn't rank that as high as I hoped for our recognized expertise. I think I think there's just not enough recognition of that, and that's the perception. And it actually ranks a little lower, although it's not statistically significant, than some of the other areas. They say we are children-focused, respect and compassion, ease of use, but we're not right up there with where we needed to be in terms of recognized expertise. So I think part of being successful is to be honest with yourself and transparent. Say, look, okay, we think we're good, but we're not getting the word out there, and we need to do that. So the approach was to build our reputation through what we called a Grow Up Stronger campaign. We involved the families in this. This is one of our neurosurgeons. You all have participated in this, and we are really investing in our doctors or in the perceptions of our doctors, our research, and really trying to create an image and perception that we are the experts and national leaders. So what's happened? So in 2 years, we are making progress. So the light blue lines, yes, I know, I'm a Carolina fan, UNC, it's Tar Heel Blue, but is the is where we are in July of 16, and that's where we were, the red line, before we started the campaign. And these are significant numbers. So we are moving the bar that the physicians are nationally recognized, and you can read all of the different things, but in every single one of them, there is a real move. And one of the ones I love is this one: patients and families are treated with respect, patience, and compassion. Although that wasn't a differentiator on national reputation, if you recall, I still love the fact that it's increased 18 points on that one. So I want you to know, this is, we look at this scientifically with rigor, and we're moving that forward. But it's not just advertising. We've created something called the Innovation District. Has anybody gone to this or seen this yet? Charlie? Maybe it's because you're in there. So rheumatic heart disease is I know that's a cardiology thing. But this is a special website and approach to build our reputation around innovation. So we need you to help us with the content. One of the things that's the most frustrating thing to our PR and marketing department is they're there, they're ready, they're pushing this stuff out. You know, I showed you, we're in science, we're in popular mechanic, whatever it was. They're pushing that stuff out there, but they need the content. They need to know what you're doing. They're not going to find that if you don't participate. So this Innovation District is a place where people can come, and it's also what we're going to be pushing out. We also have a social media approach and strategy. So this is another way of pushing it out. And just yesterday, if you, the Huffington Post, anybody look at that? Well, I do. You know, it's one of these blogs. So this came out yesterday or last night around the Star Robot, 6 ways technology is changing healthcare system as we know it. This is the Huffington Post. I mean, lots and lots of people read that. So that was yesterday, and then we're tweeting it out later. And then other people retweet that and retweet that, and that's how it works. And we have, these are just some of our measures. Facebook, we've got 96,000 likes. We need to build these things up, and we've been doubling, tripling that. So anyway, really need your help with that. But this is the way people are gaining more and more awareness. And then other ways that we're building awareness is convening experts and partners. Again, the Sheikh Zayed Institute, this was over the last weekend, had the World Congress of Pediatric Surgery here, 1,000 surgeons. Here's some of the leadership down there below. There's at least 3 CEOs, Hospital for Sick Children in Toronto, the new CEO out in Utah, a new CEO in Omaha, along with me and Dr. Eichelberger and a couple other people, the CEO from a children's hospital in India. Here's a 17-year-old who's talking about his new company in our innovation symposium. And it was just really, really, really cool. I think Jeff Dome is hosting, has gotten the Congress, the World Congress on Cancer Care next year called PSYOP. That's a big deal. This WOFAPS thing, I went to India 6 years ago to bid on it, and it felt like the Olympics or the World Cup. And so we want to support that. I know the neurologists have been hosting a conference for years. Many of you do this in the different disciplines, and these are huge, and we want our marketing department to be part of it because they'll be tweeting and sending stuff out during that, and it really builds the reputation. So what's ahead for us? Great stuff happening. We're really, I think, on the road. You know, one of the things that's interesting, and I think we all feel this as we drive here in the morning, is how Washington is evolving. It's really becoming a different city in many ways, and we're lucky to be right in the middle of it. It's a tech hotspot, lots of venture capital and investment, so it's no surprise we're spinning off 15 companies, and there's a lot of interest in those. There's more and more companies that are on the Fortune 500 list. STEM jobs, home of FDA, NIH, Georgetown, GW Howard. This is the sweet spot. This is the place to be. And we're the children's hospital in that sweet spot. So my goal as I look forward is I think that we want to step up and be, and I've been talking to a lot of our corporate colleagues in different things. Yes, I am competitive. I will put that right out there. But so are they. And they want a world-class institution because we're a world-class city. Why is it Boston, Philadelphia, Cincinnati, Houston? Why not Washington? Why not Children's National as a top 5 children's hospital? We want to make this the philanthropy of choice, a destination hospital for people from around the globe and around the nation, and a partner in development for local industry and government. And I put out on here our Walter Reed project, which we see as an innovation hub. I want to credit Dr. Summer, for Dr. Batshaw, and a lot of the other leaders for having the foresight to think about creating a campus where we can do research, innovation around children's health, and work with other partners in that sweet spot. We also want to continue our leadership as a global and national champion for pediatrics. And whether it's in the innovation and all the great things we're doing, or whether it's something that people don't want to talk about as much, mental health or child protection. And by the way, is Allison Jackson here? Allison just got the latest endowed chair and around our child protection program. So that's a huge accomplishment. But we have a special responsibility, and many of you have taken advantage of that, because we are the children's hospital that's within, within range or within sight of our Congress, our president of the executive branch, and MEDA. So we have that special responsibility to be a national and global champion for pediatrics. And then at the heart of it, we want to provide the best possible care for our children. So I'm also proud that while we're talking a lot about research and expansion of research, and we're talking a lot about the expansion of our premier programs, we have not taken our eye off the ball of primary care and mental health, school nurses, all the things that we want to do for our community. We've got the big chair here because there's a new clinic, it's expanded clinic there that just opened, and it's spectacular because in some ways it's a tale of two cities, and there's a whole different population that we have a responsibility for on the side, on the other side of the Anacostia and around our hospital. So we can't take our eye off the ball of that. Now, the last thing that I just want to talk about, and that is it does get back to children and families. And any of you that were at the race 2 weeks ago and watched these children and families in the pouring rain, it was inspiring. And it was just such a thrill to be part of an organization that has that kind of focus on its kids and families. That's how we get from good to great. And as part of that, I have taken on another project, and that is I'm writing a book, and some of you have been helping me with that book, and it's all around children's health. And I wanted to read you something, if I can find it here in my papers, about why I wrote this book. And it's a lot about being stories of being a surgeon, and stories of being a chief of surgery, and stories of being a CEO. And the book is entitled Healing Healing Children, surgeon stories from the frontiers of pediatric medicine. It'll come out in the spring. I highly recommend that you buy a copy. But if you don't, I'll find out about it. But I want to just read you, and I'm going to close with this about why I wrote this book. I wrote this book to help parents get the best health care for their children. All too often, children suffer because their parents just do not know what I know, that the best medicine and surgery for kids is in pediatric hospitals with doctors and nurses who do nothing else but heal children. I learned these lessons in my journey to become a pediatric surgeon. My teachers were amazing patients, courageous parents, and inspirational mentors. I tell their stories to shed light on the priceless value of a world of medicine and hospitals focused exclusively on children. Now, as CEO of one of the nation's leading children's hospitals, I share insights from the front lines and scientific frontiers that are transforming the care of children. With children as our highest priority, my goal is to guide parents to make the right choices for their kids' health as they navigate the confusion and chaos of a health system designed by adults for adults. Thank you.